into this if you do it enough. Patients, particularly with diabetes, get calcification in the arteries in their ankles, and we can't compress those arteries well enough to get a good ABI reading. And because of that, we do a second thing called a PVR. So the ABI, do you have any questions about that?
I'm happy you're going over that, the PVR and stuff. So when we get to the point of talking about the actual testing, Dr. Graff wants to know like what the difference and stuff of that was.
Okay, yeah. So the ABI are just the blood pressures. It's the ratio of the ankle to the arm pressures. Anything above or between 1 and 1.4 is considered normal. If they have calcification in their ankles and we can't get good compression to get an accurate pressure on those ankles, it's usually going to be above 1.4, the calculated value. So anything below 1 is showing some mild level of disease. That means there's a restriction in the blood flow in their legs.
Okay.
The PVR itself is pulse volume recording. So what we're doing is we're actually measuring the volume of blood as it passes through the limb with each heartbeat. We still use a blood pressure cuff. It inflates, but it doesn't inflate enough to occlude the artery like we would with a pressure. It's snug enough that we can actually measure the air displacement as blood moves through. So we'll get these different waveforms. On a healthy patient, it'll be nice, tall, sharp, and then we'll have the second little bump. That second bump is called the diacrotic notch. Is the lub-dub in the pulse.
Okay.
So when the arteries start to harden, we lose elasticity, and we'll actually see that little diacrotic notch disappear. So we can still have nice tall peaks, but we lose that secondary bump. As the disease progresses, the waves get shorter and wider, typically. If it's severe, we can get close to a flat line. So the PVRs aren't affected by the calcification, and that's why we do both. The ABIs give us good information. The PVRs give us good information. Together, we can fill in the gaps if there's an issue with the ABI. Any questions about that?
Nope.
Okay, perfect. All right, so your PadNet device, the PadNet itself is this white machine. You should have a power cable with it, a PPG probe, which the new PPG probes look a little different than this. They'll be like a little white clip that has them in it. And you'll have 8 blood pressure cuffs.
Mm-hmm.
The thing that most people, the biggest learning curve, I think, for this device is that just getting it set up and connected. So your computer has to be on, the PadNet device has to be powered on, and you need to make sure that your laptop is connected to the network that's titled PadNet.
Yeah.
Patient prep. Because we're taking blood pressures, we want to make sure that things that affect patients' blood pressures are kept to a minimum. So we want to make sure that they're wearing loose, comfortable clothing that exposes their limbs. We never want to place a blood pressure cuff over clothing. If we do that, it will affect the quality of our measurements. So we want it directly against the skin. If we have tight clothing, like let's say you have to roll up a pant leg to get it on their ankles,
Mm-hmm.
it can actually restrict the blood flow. So if they don't have clothing that's easily moved out of way without bunching up, we want to have them change into a gown, unfortunately.
Okay.
The patient needs to be lying flat, so all of the segments for testing the arms and legs should be roughly in the same plane as the heart.
Mm-hmm.
All of the values that your providers use to interpret these are based on a patient laying flat on their back. It's okay to give them a pillow. We just want to make sure that their arms and legs aren't elevated or below their heart too much. Alcohol, caffeine, and tobacco, not within 30 minutes of the test. And when you bring the patients back, they need a little bit of a rest period. So when you first lay them down, take the time to just get the cuffs on them. Usually takes 3 minutes or so. If they're quite out of shape, it could take a little longer. You just want to make sure they're nice and relaxed. The PPG probe. The PPG probe is essentially used only when we're doing blood pressures, and you can think of it as an electronic stethoscope. We use that to actually see when the artery occludes because we watch the pulse in the digit on the segment we're testing. Any questions about that? Okay, so this probe, the PPG probe, yours looks a little different. These are some older pictures. That needs to go on a digit on whichever limb we're testing. We want to use that to actually, so we can see the blood, we can see the pulse. We'll see when it occludes and when it comes back. And that is everything for this short